This is a new tool for applying fillers to the face. Microcannula has multiple advantages over the traditional needle technique, including smoother application and less trauma to the face. But the big advantage is the decrease in the amount of bruising. So in this video, I'm going to talk to you about how this microcannula works, and we'll actually get to see me use it in a couple of patients. Traditionally, a needle is used to make small injections around the area that you're treating, and the same needle is then used to apply the filler. If this needle happens to encounter a vessel under the skin, then you could get a bruise. With the newer microcannula technique, a small poke is made with a needle, and then through this hole, a cannula is introduced and placed under the skin. The risk for bruising is much less because there is not a sharp edge that's traveling under the skin. And in this way, you could treat a large area like the tear trough with only the one small poke. We're going to poke far away down here. So you'll feel a little poke here, Kristen. And then we take the microcannula. Okay. I'll feel it. Good, and I just kind of watch. Before, when we finished, we had several needle marks here, but I was able to actually treat this area through this poke. Pretty cool, right? And this technique can be used for many areas of the face. It can be used for the tear trough. It can be used for the cheeks. It's a great technique for the nasolabial folds, and it's really excellent for the lips. And it can be used for the oral commissure area as well. One poke here. One thing I like with this technique is you can actually leave the lips closed together while I inject. Your kissability factor is like rising.
Rising, that's good.
On the left, you can see the multiple injection sites that you would need to treat the entire face, as opposed to you could treat the entire face with the microcannula technique with about 5 injection sites. Poke here. We're going to put the microcannula through that poke. Okay, open your mouth. Good. And a question that some patients ask is, with the needle pokes, are those holes any larger, and do they stay open long? And the answer is no. Especially when we're injecting Restylane, I still use a very small needle, and these little pokes will be closed in an hour or so. Okay, so that's our microcannula technique.
Looks really nice, thank you.
Yeah.
Looks great.
Yeah, cool. I hope this video was helpful, and good luck in your search for information.